Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong. We shall never be divided. We shall never be divided. We shall never be divided, for the union makes us strong.
We acknowledge the significant impact on the training of our students, particularly I want to repeat, their hospital rotations in public health facilities. This disruption by the strike has posed a serious threat to their education and may strain our training facilities and the faculty resources if the strike continues. The teaching fraternity in Jomo Kenyatta is committed to the well-being of our students and the broader community, and we are closely monitoring the government's response to the doctors' strike. We view the government actions in tackling the strike as a reflection of its lack of commitment to the welfare of its citizens, and we demand swift resolution to alleviate the suffering and uncertainty by all stakeholders. Also, JKUAT chapter emphasizes its unwavering support for the healthcare professionals and advocating for fair working conditions and improved healthcare services in this country.
Hospitals are learning institutions for our students, and the students are generated by the universities. So the universities are getting a beating now, and this is going down to all areas. Thika Level 5 is a training institution for Jomo Kenyatta. Kiabu Level 5 is a training institution for Jomo Kenyatta, and also is Gatodo Hospital. That means that if this strike takes longer, it means that a whole class may be affected. As we are talking, Kenya has a huge shortage of doctors, because when you look at the WHO ratios, we are expected to be at 55,000 doctors. Yet the public sector today does not have anything more than 6,000 doctors. In this case, it means that the few doctors that are at work are struggling to be able to handle the illnesses that are there in the country and the population. We as KMPDU are not ready to go back to work until this issue of interns is properly resettled as per our CBA of 2017, which was signed by the national government and all the 47 counties. And they did this after consulting SRC, and SRC gave them a go-ahead by proving that there will be adequate money to effect it.
I want to state here that the doctors are not asking for anything new. Doctors are asking the government to obey a collective bargaining agreement that was negotiated, registered, and signed in court of Kenya in the Employment and Labor Relations Court. That CBA is what the government want to deny. This is not just an assault to medical doctors, but the unionism in this country. We are aware that they have a plan to make unionism irrelevant in this country, and we are not going to allow that. And I'm also calling other unions in all sectors to join doctors and other healthcare workers who are on strike, so that we can make our voice heard now and forever in the future.
There is only one point I want to clarify for people to know, because the so-called stipend that is supposed to be paid to medical officer interns is because it has been alleged that the numbers were so high that the numbers that are coming from the training institutions are so high, and the government or the MOH was not aware of these numbers. I wanted to rebut that statement because, as far as I know, the body that is concerned or was concerned with the admission of medical students was actually KMPDC. It was the KMPDC that used to instruct the training institutions the maximum number of students they could admit. And as we are talking today, the medical officer interns were admitted somewhere in 2018 when it was the KMPDC that was in charge of the numbers that were supposed to be admitted. This function was ceded to CBA somewhere, I think, in 2020 or 2022. So the numbers that we are talking about now are numbers that KMPDC was aware of. So when somebody comes and says that they were not aware of the numbers that were being churned from the training institutions, I think they're being very economical with the truth.